If you saw the thumbnail, you're probably wondering, where exactly do I need to contract to change everything about my potency? You might be doing everything else right, optimizing your hormones, fixing your diet, maybe even taking medication to increase blood flow, but you are still struggling to maintain full rigidity. Why is that? Because you are ignoring the most critical mechanical component of the entire process. There is a specific set of muscles that acts as the physical gatekeeper between a soft state and a rigid one. When you contract these specific fibers, you are essentially closing a high-pressure valve. If you don't know how to engage this area, or worse, if this area is dysfunctional, it doesn't matter how much blood flow you generate, it will simply leak back out. Most men treat erection quality as purely a vascular issue, thinking they just need to pump more blood in. But that is only half the equation. Today, we are going to look at the pelvic floor not just as a support system, but as the active engine behind erection strength. By the end of this video, you will understand exactly how to control this mechanism. To understand control, we have to stop obsessing strictly over blood flow. The biggest misconception in men's health is that a strong erection is solely about how much blood you can push into the penis. While arterial inflow is necessary, it is useless without a mechanism to trap it there. Think of your erection mechanics like filling a bathtub. You have a faucet that pours water in, that represents your arteries. You also have a drain that lets water out, that represents your veins. In a flaccid state, the faucet is off and the drain is open. When you get aroused, the body turns the faucet on. Blood rushes in. But here is the critical part that most men miss. For the bathtub to fill up and actually hold water, you have to plug the drain. If that drain remains open, you can have the most powerful faucet in the world, meaning excellent arterial health and high testosterone, but the tub will never fill to the top. It might get half full, maybe even 3/4 full, but it will never reach that maximum pressure required for distinct rigidity. In medical terms, we often call this inability to store blood venous leak, but often, it's not a broken vessel. It's a failure of the muscle system responsible for closing the drain. This is why pills often fail or stop working over time for many men. Medications like Viagra or Cialis work primarily on the faucet. They force the arteries to dilate and increase the speed of blood entering the system. They do almost nothing for the drain. If your pelvic floor muscles are too weak or dysfunctional to compress the veins and close that exit route, the medication will pump blood in and it will simply wash right back out. So, the missing link isn't usually about getting more blood in. It is about the physical compression required to keep it there. That compression comes from a very specific set of muscles that surround the base of the penis. When these muscles function correctly, they clamp down on the veins, trapping the blood inside the pressurized chambers. If they're offline, you lose rigidity. Let's look at exactly which muscles these are. However, there is a critical caveat here. Even if you fix your muscular drain, it won't matter if your faucet is barely dripping. You need massive, oxygenated blood flow to fill the chamber in the first place so those muscles have something to clamp down on. If you feel like your natural flow has weakened over the years, you need to see this. There is a presentation on a bizarre, natural purple tonic that takes just 7 seconds to prepare. It targets the root biological cause of weak flow, something dangerous pills completely ignore, and it acts like rocket fuel for your system. I've placed a QR code on the screen right now. Point your camera at it to watch the video explanation. I also pinned the link to the top of the comments below. If you combine that nutritional strategy with the muscular mechanics I'm about to show you, you become unstoppable. Now, assuming your flow is ready, let's look at exactly which muscles control the lock. We need to stop using the vague term pelvic floor and get specific. The pelvic floor is a complex web of muscles, but for erection quality, 90% of the work is done by two specific players, the ischiocavernosus or IC muscle and the bulbocavernosus or BC muscle. Let's start with the IC muscle. If erection quality were a sport, the IC muscle would be the MVP. It connects from your ischium, your sit bones, directly to the crura, which are the roots of the penis hidden deep inside your pelvis. When the IC muscle contracts, it does something unique. It forces blood from the roots up into the shaft and, crucially, it compresses the base against the pubic bone. This compression is what creates the high-pressure angle. If you can make your penis jump or lift while erect, that is the IC muscle working. It is primarily responsible for rigidity and the angle of the erection. Then we have the BC muscle. This wraps around the bulb of the penis and the urethra. While the IC is about structural rigidity, the BC is the pump. It is responsible for the rhythmic contractions during ejaculation, but during the erection phase, it helps engorge the glands, the head of the penis. Now, here is the mechanism you need to visualize to understand why this matters. Inside the penis, you have the spongy chambers called the corpora cavernosa that fill with blood. Surrounding these chambers is a tough, fibrous sheath called the tunica albuginea. When the chambers fill, they push against the sheath. However, to get that rock-hard quality, the IC and BC muscles must engage. When they tense up, they exert physical pressure on the veins running through that area. It acts as a mechanical clamp. The inner pressure rises, the muscles squeeze from the outside, and the veins get pinched shut between the expanding tissue and the muscle wall. This is the veno-occlusive mechanism in action. If these muscles are atrophied or disconnected from your neural drive, they cannot exert enough pressure to pinch those veins shut. The result? You get swelling, but you don't get hardness. You get fullness, but you lose it quickly. It is a muscular failure, not a hormonal one. This leads us to the hidden enemy that destroys erection quality for millions of men, and it is usually the exact opposite of what you think. When men hear pelvic floor, they almost immediately think Kegels. They think weakness. They assume that if their erections are soft, their muscles must be too loose, so they start aggressively doing hundreds of contractions a day. For a large percentage of you watching this, that is the worst thing you can do. The problem isn't always that the muscles are too loose. It is often that they are too tight. This condition is called a hypertonic pelvic floor. Imagine walking around all day with your fist clenched as hard as you can. If I asked you to pick up a heavy object with that hand, you wouldn't have any strength left to grab it because the muscle is already exhausted and locked in a shortened state. A muscle needs to be able to fully relax and lengthen in order to generate a strong contraction. If your pelvic floor is chronically tight, locked in a permanent semi-contraction, it cannot dynamically squeeze when you need it to. It has no range of motion. So, when the moment comes to trap that blood and create rigidity, the muscle is already maxed out. It creates a rigid, tired floor that feels weak, but is actually overworked. Why does this happen? It is largely a result of modern lifestyle and stress. Just as some people grind their teeth or hunch their shoulders when they are stressed, many men unknowingly clench their pelvic floor. High anxiety, chronic stress, and specifically sitting for long periods contribute to this. When you sit all day, you are constantly compressing the perineum and shortening the pelvic muscles. Over years, your brain forgets how to relax this area. This hypertonicity creates a double-edged sword. First, a tight muscle strangles the blood flow and nerve impulses required to initiate the erection. Second, because the muscle is shortened, it loses the mechanical leverage to close the veins we talked about earlier. You end up with hard, flaccid symptoms or inconsistent erections that fade the moment you stand up or change positions. If you have a hypertonic floor, doing standard Kegels is like trying to fix a cramp by flexing harder. It only increases the tension. Before you can strengthen the mechanism, you have to restore its length. You have to learn to let go before you learn to squeeze. Understanding the difference between a weak muscle and a tight muscle is the turning point for restoring potency. A healthy pelvic floor is not just strong, it is flexible. It acts like a trampoline. It needs to stretch down to generate the force to bounce back up. If it's as stiff as a board, you get no bounce and you get no rigidity. Now, we need to locate these muscles on your own body. You cannot strengthen or relax a muscle you cannot feel. We're going to do a quick diagnostic right now to see if you have a proper mind-muscle connection, or if you have what we call sensory amnesia in your pelvis. First, let's find the BC muscle, the pump. The easiest way to identify this is the stop peeing cue. Next time you are urinating, try to stop the flow midstream for just a second. The specific muscle you use to pinch off that flow is the BC muscle. I want to be clear. Do this once or twice just to locate the sensation. Do not make this an exercise you do every time you urinate, as stopping the flow habitually can actually cause bladder issues. This is purely for location purposes. Second, and more importantly for erection angle and hardness, we need to find the IC muscle. This one is harder to isolate. The best way to feel this is when you already have some level of erection. Try to make your penis jump or lift without moving your hips. You are trying to engage the sensation of pulling the penis back into your body. That deep, structural contraction that occurs right behind the testicles, near the perineum, is the IC muscle firing. Here's the problem. Most of you trying this right now are cheating. You are likely squeezing your glutes, your butt cheeks, your inner thighs, or your lower abdominals. Put your hand on your glutes and your stomach right now. Try that contraction again. Try to squeeze the area behind the testicles. If your butt cheeks clenched or your stomach tightened, you aren't effectively using your pelvic floor. You are compensating with larger muscle groups. This is a major sign of a disconnected pelvic floor. You need to be able to isolate that movement deep inside the pelvis while keeping your buttocks, thighs, and stomach completely relaxed and soft. If you can't do that, your brain has lost the direct pathway to the potency muscles. You might be squeezing with 100% effort, but the IC muscle is only getting 10% of the signal because your glutes are taking over. To fix this, we need to remap the neural connection. Now we arrive at the protocol. This is the actionable roadmap to take you from dysfunction to high performance. But before you start, understand this. The pelvic floor is skeletal muscle, just like your biceps. You wouldn't go to the gym and curl a dumbbell for 8 hours straight every single day. If you did, your arm wouldn't get stronger. It would get inflamed and weak. The same applies here. We are looking for precision and recovery, not exhaustion. This protocol consists of 3 distinct phases: release, isolate, and angulate. Phase 1 is the release. Before you ever attempt to strengthen the pelvic floor, you must ensure it is at its full resting length. We do this through the reverse Kegel. This is the antidote to the hypertonicity we discussed earlier. To do this, sit or lie down comfortably. Take a deep diaphragmatic breath, meaning your belly expands, not your chest. As you inhale, instead of squeezing, I want you to gently push your pelvic floor out and down. Imagine you are trying to gently push out a drop of urine or pass gas, but very lightly. You should feel the space between your genitals and anus expand and lower. Hold this drop for 5 seconds while inhaling, then exhale and let it return to neutral. Do not strain. This is a relaxation cue, not a push. If you suffer from premature ejaculation or hard flaccid symptoms, you should spend 80% of your time on this release phase before ever moving to contractions. You need to reset the muscle tone first. Phase 2 is the isolation. Once you have learned to relax, we introduce the strengthening stimulus. This is the standard Kegel, but modified for isolation. We are not doing hundreds of rapid-fire pulses. We are doing high-quality holds. While lying down, inhale to relax, and on the exhale, gently engage the IC and BC muscles. Remember the cues. Stop the gas, stop the urine, lift the penis. Aim for only 50% intensity at first. Why? Because at 100% intensity, your body will instinctively recruit your glutes and abs to help. We want to starve those big muscles of involvement. Squeeze the pelvic floor, check your glutes to ensure they are soft, and hold for 5 to 10 seconds. Then, fully relax for 10 seconds. If you cannot fully relax between reps, you are doing too many. Quality over quantity. Phase 3 is angulation and gravity. This is where we apply the principle of progressive overload. Most men start lying down because it takes gravity out of the equation. It is easy to hold blood in the penis when you are on your back, but real life doesn't always happen lying flat. Once you can comfortably perform your isolation holds lying down, you must graduate to doing them standing up. When you stand, gravity is pulling blood out of the penis. Your pelvic floor muscles have to work significantly harder to fight that gravitational pull and maintain the venous clamp. Standing Kegels are the true test of functional potency. You will likely find you have much less control standing up that is normal. That is where the training games happen. The routine. Do not do this every day. Muscles grow and strengthen during rest, not during the workout. Aim for 3 to 4 sessions per week. A session might look like this: 2 minutes of reverse Kegels to warm up and lengthen the tissue. Then, 3 sets of 10 repetitions of the isolation hold, resting 30 seconds between sets. Finish with another minute of reverse Kegels to ensure you don't walk away with a tight pelvic floor. If you start feeling pain, or if your erection quality temporarily dips, it usually means you are overtraining or tightening up. In that case, drop the contractions completely and focus only on the release phase for a week. Listen to the feedback your body gives you. Finally, understand that you cannot optimize a system that is constantly under siege by your daily habits. The pelvic floor does not exist in a vacuum. It is the floor of your entire core. If the walls of the house are crumbling, the floor will not hold. The biggest sabotage to the protocol I just gave you is your posture. Most men today suffer from either anterior pelvic tilt, where the butt sticks out and the lower back arches, or they sit on their tailbone in a slumped position. Both of these postures shut down the pelvic floor. When your pelvis is tilted incorrectly, the muscles are either chronically stretched or chronically shortened, making it impossible for them to engage the veno-occlusive mechanism when you need it. Fix your posture, and you fix the leverage of these muscles. If you sit for work, get up every 30 minutes. Reset your pelvis. Breathing is the second integrator. Shallow chest breathing keeps your body in a fight or flight sympathetic state. This constricts blood vessels and tightens the pelvic floor. You need to practice deep belly breathing throughout the day. This keeps you in a parasympathetic state, the rest and digest mode, which is biologically required for an erection to occur. This is not a magic pill that works overnight. Neural adaptation, the process of your brain relearning how to use these muscles, takes time. You might feel a difference in a week, but permanent structural change typically takes 6 to 8 weeks of consistent practice. Do not get discouraged if you don't see rock-hard results on day 3. You are reversing years of neglect. Stick to the protocol. Prioritize the release before the strength. Fix your mechanics, and the hydraulics will follow. If you want to dive deeper into the science of men's health and performance optimization, make sure you are subscribed to the channel. We are going to keep peeling back the layers on the mechanisms that actually control your physiology.